wonderful opportunity today and invite, and what a warm welcome from General Harris. Thank you so kindly, sir, for all of your work and efforts that you do on behalf of the state of Ohio. Before I
Hello.
get started, I would really like if you all could make sure that your phones are muted because there is a lot of background noise. And Pete, I want you to let me know if you can hear me okay.
I can.
Wonderful. Well, welcome to everyone across this great nation. We really appreciate your time and attention today as we talk about our military-connected youth, their families, and our communities in which they reside. We have an esteemed panel today that will be helping us as we navigate this conversation on health and wellness. And so in terms of the process, I will have them briefly introduce themselves, talk a little bit about what they do, and then we will kind of go into a general question, conversation, and discussion period. After we conclude that, that's going to take us about 45 minutes. If you have any questions, if you would put them in the chat box, and we will allow for 15 minutes of just answering your questions. We have some wonderful panelists today. I'm going to just share who they are a little bit, then I'm going to hand off to each one so that they can share a little bit more about who they are and what they do. We have Erin VanGorden from the Ohio Army National Guard. She's in our Family Readiness office. We have Monica Lynchy. She is the director of Ohio Brain Injury Program at the Ohio State University. Also, we have Dr. Monica Meyers, who is the Director of Curricula, Instruction, and Assessment, and she is a Purple Star point of contact with the Jackson local schools. And then we have Sarah Jameson, who is at 7 County Services. She works with the Military Family Prevention Services, as well as she is a behavioral health coordinator in Louisville, Kentucky. So first, I am going to start off with Erin VanGorden. Erin, if you're on, can you introduce yourself?
Good afternoon. Can you see me okay? There we go.
No, I don't see you yet. There we are, yes. Hi, Erin, how are you?
Good, how are you doing?
Real good. Thank you for joining us today.
Thank you for having me. To introduce myself, my name is Erin VanGorden. I'm a contractor for the Family Readiness Department within the Ohio Army National Guard. Currently, I'm working as the support system coordinator, supporting mental health education and suicide prevention efforts directed at families and support systems of soldiers. I also have a background working with Ohio Military Kids, which is a partnership between the Guard and Ohio State University Extension that creates opportunities for military kids and military families to support each other and get together and share experiences and truly just lean on each other through non-traditional settings like camps, like family camps and day camps all throughout the state.
Thank you, Erin. I really do appreciate your work, and we're looking forward to hearing a little bit more about the services to those children. Thank you for all that you do. Monica Lynchy.
Hi, everyone. I'm so excited to be here with all of you today and on this really wonderful panel. Like Adrena said, my name is Monica Lynchy. I'm the director for the Ohio Star Behavioral Health Providers Program. This program is administered within our statewide Ohio Brain Injury Program, and that is housed within the Ohio State University. The STAR Behavioral Health Providers Program, or you'll hear me refer to it as SBHP, began in Indiana at Purdue University, and it's now offered in multiple states, including Ohio. The SBHP program, it's a resource for veterans, for service members, their families to locate behavioral health professionals that have specialized training in understanding and treating military service members and their families. Our training with SBHP gives information on how to provide services to military families with an emphasis on understanding the real uniqueness of treating someone with needs specific to the military. Behavioral health providers who are eligible can then be listed on our online registry, and that's where military connected families can search for and find providers in their area to meet their needs. Those that are listed on our online registry will have completed a series of trainings that are really intended to make them better able to understand, to assess, and provide counseling to members of the military. We started this program in Ohio in 2015, and since then we've trained over 3,200 individuals across our 3 tiers of training, and we have almost 300 providers listed in our online registry. And providers in 57 of our 88 counties across our state. We're really focused on making sure our community readiness is where it needs to be to serve the families that are in our communities in Ohio. Thanks, Adrena.
Thank you so much, Monica. I am so proud of that program because it is in the local community. It has access to a portal that you can find a provider that serves military constituents, whether it's children or adults. You can go into the portal and find a provider within your local zip code area. And that program is across the state. So thank you, Monica, for that awesome program that the Ohio State University's Ohio Brain Injury Program administers. Okay, Dr. Meyers from Jackson Local Schools.
Hello, everybody. I like to be the other Monica, so that's been an unusual name most of my life, so the two of us here is great. So I'm the Director of Curriculum Instruction and Assessment at Jackson Local Schools. We're about 6,000 students strong in 6 buildings, and all 6 of our buildings are Purple Star awarded schools. A big portion of what I do as a curriculum director now includes that mental health piece, the professional development for all of our staff, and then certainly mental health programming for our students. So it's very important to me that we bring that to our military connected youth here. It's very personal for me and why I'm the point of contact for our district. My son-in-law deployed to Afghanistan. My son deployed last year to Kuwait, returning home just this summer in July. And I have 15 family members that are currently serving or have served in the armed forces. And here at Jackson Local in Stark County, Ohio, we are very close to the Akron-Canton Airport that services many National Guard units. So they literally are in our backyard. And so this work is very important to our district. So thank you so much for having me today.
I think I was on mute. Thank you so much, Monica. Appreciate all that you do and leading the effort as a point of contact in the Jackson Local Schools. Sarah Jameson from Louisville, Kentucky.
Good afternoon. Thank you for having me here today. My name is Sarah Jameson. I'm the Military Family Resiliency Specialist for 7 County Services. I'm also the proud daughter of retired Navy veteran, 2 OIF combat soldiers as my brothers and Gold Star sibling. And my role as the Military Family Resiliency Specialist, I work across the state of Kentucky with the National Guard, the VA hospitals, veteran service organizations, and other community groups to develop and coordinate evidence-based prevention strategies that decrease risk factors and increase protective factors for substance use and mental health issues within military families. And what we do is we work with data collection agencies, and we evaluate the data, and then we work to build capacity at the local grassroots level to address these issues with education, advocacy, and environmental strategies. So thank you all for attending today.
Thank you so much, Sarah. We really do appreciate all of the work that you do and look forward to talking a little bit more about the work within the communities. Let's start with just jumping in and talking about what goes on as a military point of contact within a school. Monica Meyers, could you share a little bit about if folks were interested in really being a military point of contact within their local school district? What would that entail, and how could they really get started?
Sure, I'd be happy to speak to that. Really jumping in would be primarily in the application process for Purple Star designation, and work either doing it yourself or in collaboration. And we were fortunate here, we had another teacher very passionate about military that worked very closely with me with our high school initial application. And then we just reapplied for our high school, and I brought maybe 5 more people. So as you spread the word and the passion about the work, I think people will flock to you. Our military is important. As our Major General Harris said, we're all a part of that, and that so resonated with me that we're contributing to that readiness with our reach out to our military connected youth, and certainly that involves the families. It's an extension. Schools service the entire family, not just the child that attends school, but the entire family, and we make that a team approach. And then so through the application, through the reapplication, and then identifying your military connected youth at your school, how you do that, monitoring that. I reach out to our school counselors on a regular basis because we want to honor all of our Purple Star students here, 2 of which are my granddaughters. And so again, that's very important to me. And I try to think of them as being other, the children of our military parents or those grandparents. So looking at that extended military family. So they're military connected youth, not just if mom or dad are connected, deployed, active duty, reserve duty, but grandmas and grandpas, because so many of our families are being raised by that extended family, or aunt and uncle, brother, sister. So building those connections, identifying, building those connections, and then reaching out at a personal level. And I think that's where my personal experience helps. We don't want to do things to them or necessarily for them without asking, especially if a family is getting ready to deploy or returning from a deployment. There can be lots of emotions wrapped around that. And so it's reaching out and asking family wishes first and foremost, and then sharing with the who needs to know. And so as a point of contact, I really work with all of our stakeholders in understanding that component of it. And, we just had a dad return from deployment, and he was very willing to come into the school and share that joyous engagement with his 2 children with everybody to observe. But not everybody is like that. And certainly there's a safety aspect for our military families when they're deploying or when they're about ready to come home. So respecting family wishes as a point of contact is really important. But you also have to make all the connections that you can in order to support them. So reaching out to FRGs, reaching out to, your local units, reaching out to where do they attend church if they're church-going people? Can you solicit assistance from them? So really just networking with just about anybody you can, keeping in mind that my job is to support the military connected youth.
Adrena, you're on mute. Adrena, you're on mute.
Just somehow that's automatically doing that. So that leads me to Erin. As a family readiness person in the office, how do you connect with youth who may have a concern or an issue that they need some support by? And how do you link to a school that may have a military point of contact staff person?
So first and foremost, our point of contact with family readiness between the family readiness and Purple Stars in the schools is Chip Merkel, and he does a great job reaching out to schools, even non-Purple Star schools, to engage with them, ask them questions about what they're doing at the school level. So he's great at that. Within the National Guard specifically, we do a lot of things at a state level. And we do have parents that reach out and ask questions about, their child or teenager is struggling at their school level. And so maybe when it's appropriate, we help connect them with people that can advocate for them as a military family or their military kids. But also we help just link them to services. Maybe they need counseling. Maybe they just need someone to talk. It doesn't have to be long-term counseling, but maybe just some couple conversations here and there. And we have psychological health providers that are great within the National Guard that we can connect them with. And I would say if you have questions, reach out and we can definitely help you connect to people in your own community as well.
Thank you so much, Erin. I appreciate that. Sarah Jameson, can you share a little bit about your involvement with the community coalitions and support for military families outside of the actual school building?
Yes, so as a military family prevention specialist, I am also a certified prevention specialist, and there are approximately 120 of us that work across the state of Kentucky in our regional prevention centers, which are attached to the community mental health centers. And what we do is we provide consultation and technical assistance to the local coalitions, which some of them can be drug-free community grant recipients through SAMHSA. And what these local coalitions do is they look at data surrounding alcohol, tobacco, and other drug use, and they look at strategies for reducing those risks. And so as a prevention specialist, I work with the coalitions to help bring awareness to the additional risk factors that some military youth have. And so it's a lot of training with them and just bringing that awareness and showing them the risk factors. And then these drug-free communities are in certain locations, in certain neighborhoods. Sometimes they're county-wide, sometimes it's zip code-wide, and they do social norms campaigns, which just use positive messages that youth help to create. So it really brings awareness to those youth, such as, military kids strong, and other social messaging campaigns that go throughout the school district, throughout the community, to really help bring awareness and bring support. In some cases, we have military affiliated clubs within the schools that can be coordinated through the coalitions. And so the coalitions can be a huge support for the schools in getting that community involvement. Usually the coalitions have a member from each of the 12 sectors which includes education, government, the health department, education, and faith-based legal systems. And so by working with the coalition, you are really being able to engage the entire community.
Wonderful. If a school personnel who would be serving as a point of contact or other teachers would want some additional resources, where might they be able to find resources around military families and kids?
So for the state of Kentucky, we are new to the Purple Star program. We launched our first Purple Star schools in October, and we have a website that has a resource tab that is specifically designated for schools. And so there's some informational documents on there that school professionals can download and print out, and it gives you some coping mechanisms and warning signs and different activities and things like that that are on our website. But if they are looking for more specific referral type of resources for families, then there is a different tab that includes all of our state and national resources, as well as contact information for the community mental health centers. And so if they are needing some local contacts, then they can reach out to their regional prevention centers to get local support.
Wonderful, thank you. And what is the name of that website, just in case we have some listeners that would like to take a peek?
It is kypurplestar.org.
Wonderful. Thank you so much, Sarah. Speaking of websites, here in Ohio, we have an Ohio Cares website. So it also has some of those provider agencies and other information that would help in the health and wellness space. It is ohiocares.ohio.gov if you are interested in taking a peek at that website as well. And I do believe that Pete and Chip Merkel both have sent out some other resource links that you may find helpful. So let's talk a little bit about training opportunities for professional development or other adults that may be in this space, whether it's caring for children or in behavioral health space. And I wanted to speak to Monica, if she could just talk a little bit about, this is Monica Lynchy, about a little bit about the STAR provider training and how it's organized and what kinds of trainings that are offered.
Yes, thanks, Adrena. I would love to talk about this. The STAR Behavioral Health Providers Program has really two faces, and one of them is the online searchable registry that I talked about briefly, but the foundation of this is a training program that is targeted at behavioral health professionals in our community. But our first tier of training is open to anyone that is interested in learning more about military culture and the impacts of the deployment cycle on the service member and their families. I really value this program. I am a licensed counselor by training and ended up in brain injury research after 10 years of work in the community mental health field in Franklin County, Columbus, Ohio. And I reflected when we first started working on this program about the training that I had received, and that there was really no training in my graduate program for counseling that touched on the uniqueness of military life. The culture, my goodness, the acronyms, we all have our own acronyms, but the military really puts us all to shame with theirs. And the really unique aspects that impact those that are not only serving, but are that are surrounding the service member, the families, the people in their communities. And so the first tier of training is open to the public. And the first tier of training does two things. The first half of the day teaches you about military culture, and you learn a lot in that bit. And then the second half of the day talks about the impact of the deployment cycle, and the cycle being from all the way from the very beginning of just learning that there might be a deployment coming to the actual deployment itself, and then reintegration, the post-deployment impacts on the service member and the families. This is really valuable information for everyone. These trainings are free. Because of the pandemic, we learned how to do these online, and so they're not just in person, although we are offering them in person again. And so we have these done online also. And then beyond that first tier of training, we do offer more specialized tiers in our tier 2 and tier 3. Those are for our behavioral health professionals that want to continue on and learn more about the very unique aspects of military life and some of the things that might impact them. For instance, in tier 2, it's a 2-day training where you'll learn about brain injury and military life, sleep problems and military, suicidality. Lots of different aspects are covered in those 2 days. And then our third tier of training is unique every time you take it. And those are really our evidence-based psychotherapies that can be used by our behavioral health professionals that have been shown to work very well with our military connected families and our service members.
Thank you so much, Monica. That is an awesome, awesome track of training. And share the cost.
Yes, so it is free. And not only is it free, but for those of you who are looking for CEUs, we offer free CEUs. And so I love that because for our first tier of training, we kind of reel people in with our free CEUs, and then they fall in love with the program and they stay for the rest of the tiers too.
Thank you so much. And we appreciate your hard work again, providing that for the state of Ohio. I guess this next question is for Dr. Meyers, Dr. Monica Meyers. If you see a student within your local school district is having concerns, what happens? What is the process?
Great question. So in our district, we've worked quite a bit on building a protocol. So hopefully no child, military connected youth or otherwise falls through the cracks. So the majority of our staff have been through youth mental health first aid training. And unfortunately, COVID kind of put a halt to professional development, and we're hoping to get back to that. But we have a process because we do have school-based mental health counselors at the middle school and high school level. And so our point of contact is the school counselor. So we do a lot of work in communication through teacher-based teams, building leadership teams. That's our protocol. If you suspect any questions, any concerns, go to the school counselor. They might be able to fill you in, but you also might be letting them know this is the first they've heard that this child or somebody in that family is suffering, especially if we don't know about an impending deployment or maybe a return. And again, our families self-identify as military connected and some do not. You know, you have to really cast that net and reach out and open that door so that they have somebody to come to and they're willing to self-identify. So it's a constant work in progress. So they can go to our school counselors, and then they basically will do an assessment to see if they need to be referred to a school-based mental health counselor, any outside counseling, and certainly if they're a military youth, connected youth, we're all on a page with what those needs might be. We're by no means experts, so even I'm listening to the resources that are presented in today's town hall, and I'm getting all these ideas on how we can help our children. But I think it's really important, if you're that point of contact to really make sure that you are aware, is there a process in place at your school that you can follow that protocol to make sure that assistance is given to that family as soon as possible. We're also very fortunate in Stark County to have family support specialists. And so they facilitate a list of at-risk students and try to hook them up with school counseling, outside counseling, food, clothing, shelter, all of those things. So we have another system in place that really helps. And some of our military connected youth are part of that process as well. She's the first person I give outside resources that come to me. She might be talking to a family I don't know about, but there might be a camp for military children. All those things that Chip and Pete push out to us as resources, she's the first person I give that to. Do we have any military families that, you know, need dance lessons, can go to a horse camp, need some counseling by riding on a horse? We have a local horse farm that does that for military youth and military families and offers free counseling. So it's knowing too what to do with those resources. So I hope that helped to answer that question.
Thank you. So my last question would be for Erin before we go to our questions to the general audience. Erin, could you share with us a little bit about Ohio Military Kids and the camp? And what kinds of value do the kids and the students find in that experience?
Yes, so Ohio Military Kids started out as Operation Military Kids, which was a national call to what are we doing to support our military kids, specifically National Guard kids, all across the state, because National Guard families and kids may not have friends or families that are military connected. And so they're kind of out on an island on their own. So Operation Military Kids was started in the state, and then in 2015 it switched over to Ohio Military Kids. Essentially, the goal of the program is to provide non-traditional learning opportunities and experiences to military kids while hanging out with other military kids who are going through similar experiences. Our most popular, and I think what we're most well known for, is our week-long Kelly's Island camp. That is for youth as young as 9 to 11, and then our teen camp, which is 12 to 15. And it has all the benefits of a regular 5-day camp, but while these kids are doing water sports, while they're doing arts and crafts, they're having conversations with their counselors who I think about 60% of the counselors are military kids themselves, and the other percentage are not. And they're having conversations with each other about, oh yeah, this is what it's like to be a military kid. Military kids have similar experiences, but each individual kid's experience is different than another National Guard's child. You know, their parent might be deployed overseas while another child's parent has only been activated because of, you know, COVID responses or a natural disaster. The camps follow the values of the military, and so there's that military influence. We talk about military things. They try to incorporate military members, whether it's leadership, or encourage parents to talk about their experience in the military, just to kind of broaden the kids' awareness of what it's like to be in the military, because they only know the experience of their parents. At the end of the day, it's just encouraging kids to build those relationships. And it's surprising that the biggest impacts that are had with kids are the small conversations, you know, before they're getting ready for bed. And, you know, someone's talking about how they miss home, and another kid's like, yeah, this is what I did when, you know, my dad was away. and this kind of helped me calm down for the night. And they can build each other up and support each other in a way that maybe their friends at home who are trying to support them as much as they can, but it's not the same as being supported by other military kids.
Wonderful. Thank you so much, Erin. And so now I'm going to open it up for questions that the general participants may have. If you could put your question in the chat. And Pete, would you like to help assist with navigating the questions at this time?
Sure thing, absolutely. As folks are going ahead and throwing questions in the chat box, I know the Chief Operations Officer of Military Child Education Coalition is on the line, Tim Farrell, and he helped us over the years, pre-Purple Star, pre-global pandemic, and they're doing special things in the space out there in the great state of Texas. So if you want to do a few moments of commentary and resources that MSEC has out of Texas, that would be great, Tim.
Hey, Pete, I appreciate that, and thank you, thank you, General Harris. Thank you, everyone on the line here that's contributing to the wonderful leading edge that has been Ohio Purple Star Schools. I don't know if any of you refer to him as such, but throughout the nationwide community with Purple Star Schools, we refer to Pete as the Godfather. And that is a richly deserved moniker for somebody whose idea and whose passion didn't just resonate in Ohio, but grew legs nationwide, and the entire nation is better for what you all have done in Ohio. So I'm really grateful for that. MSEC is the national advocate for the Purple Star Schools program, and through generous philanthropic relationships as well as funding from various state governments, we've been fortunate that we've been able to develop Purple Star School readiness toolkits, both in terms of discrete training, which we can deliver virtually or in person, or in a combination format, as well as some resources to help with all the elements that vary state by state with some uniqueness to them, but are largely similar to where we can be helpful to Ohioans, to Kentucky residents, and to everybody around the nation to get you more Purple Star School ready, and ideally doing it not only not on the backs of the military families, but just as importantly, not on the backs of the school districts. It's really important to us that we look at the school districts as the end users in this equation as well, because if I was sitting on a school board and if training for a small but very important part of our population was on the table to pay, whether it's MSEC or anybody else. And I had to put gas in the bus, and I had to put food on the table, and I had to help the teachers outfit their rooms without having to dip into their own wallets. I probably wouldn't vote for it either. So that's all the more reason that we look to our philanthropic supporters and we look to the states to do right by this wonderful population and the education ecosystem that serves them. So my colleagues and I believe Amanda Woodyard, Tara Gleason, Andy Jano, and Georgia McCown are on the line, or at least a number of them are on the line here. We're at your service anytime. We'll put our emails as well as our website in the chat box, but holler at us anytime and we're here to help.
Thank you, Tim. And if websites want to be thrown in the chat box as well, from Sarah in Kentucky, if you want to go ahead and throw your website in there. I see the question was asked about the tiers of training and those various elements there. That was placed in the chat box. Start Behavioral and all the panelists that obviously represent great organizations, professional, public health, and on down the list, especially for our mill kids, if they want to go ahead and throw those sites and email addresses for future contact and further contact after we close up here in about 15 minutes, give or take. Thank you. Sarah, did you hear me in regards to Kentucky? I'm shouting over there across the Ohio River. Hooday.
Yes, I am.
Okay, great. Go ahead, Sarah. Thank you.
Well played yesterday, by the way, too.
think we might have answered several of these questions through just continuing here. Sarah, do you want to add anything? Because obviously you are the perhaps newest Purple Star state amongst the 108 of those of us that are logged in here today. Do you want to add any updates from the state of Kentucky there?
No specific updates, but definitely agree with Tim Farrell about Pete being the godfather. We certainly appreciate your help down here in Kentucky walking us through. I think Kentucky has taken a unique approach and really built our Purple Star program from the grassroots and the coalition level at a statewide advisory board. We've had huge support from our governor's office. And so we're just really excited. We've been working very closely. COVID has, slowed things down a bit for us, and our first launch wasn't as large as we would have liked. But the moment that our Safe Schools director and coordinator started sending out emails to superintendents, we immediately started getting hits, and schools are really excited about taking on this program. We're working with our Troops to Teachers program, our JROTCs, and we're just grateful to be able to have this program as a resource for our military connected families here in Kentucky. So thank you all for what you do, and we definitely appreciate you paving the way for us. So thank you.
Absolutely. And we got other neighbors here in the Ohio River Valley, whether it be West Virginia and Indiana. So we're proud of our neighbors as they proceed with Purple Star, but we're particularly proud of our pioneering 400 Purple Star schools or so that include preschools, that include career technical centers, that include private schools. I see my friend Barb Barbo from St. Albert the Great Catholic School, K-8 in North Royalton, Greater Cleveland, Ohio. I'm trying to look for questions here. I think they're being answered one way or another through the chat box. I did include Adrena Tart's email address, a great leader here today, as well as William Chip Merkel with the Ohio Army and Air National Guard, as the general pointed out Chip's service to Ohio.
And there's a question, Pete, about when families move with military, how would you advise and give those families Purple Star designated schools? So how would they link to a Purple Star military school in a different location?
Sure. So that's a specific and a very tough question, right? But let me be completely honest, right? We have 30 plus Purple Star states across the United States, in some heavy military states, right? California, Washington State, hopefully soon, where I served as an enlisted junior sailor, Texas, and of course, Virginia was the first state to replicate Ohio's framework, and Florida, and many other states, but we're not 50 plus, if you will. 50 plus one strong. So, and of course, we're a global fighting force, right? But we have obviously great resources through the United States Department of Defense Education Activity, or DODEA. So I would say that school liaison officers, MIC3 commissioners can let you know what the status is of certain supports, including Purple Star. But again, it's not exactly completely perfect, as in there's a directory, et cetera. The Ohio Department of Education led the effort here in Ohio. It was the New Hampshire National Guard that led the effort for Purple Star in New Hampshire. So different entities have led the way. So I wish I had an exact answer there, but I would definitely Google, definitely Department of Education's for their respective states. In Texas Education Agency, on down the list. Hopefully that answers your specific question. Sometimes Googling is really the right way to go forward in that sense. Did I miss another question? They went up fast here on my.
Yes, there's another question from West Virginia. Renee Maman is a school counselor at Taylor County Middle School. And she's a point of contact in her school district. And how would she go about getting some of those resources so that she can pass them on to families. So one of the things that I definitely want our callers to know is that across the country, the VA has community engagement program coordinators. So the VA has invested in community engagement program coordinators. And these coordinators are, one of the purposes is to engage within the local community across systems. And that could be, they could be trying to get engaged with coalition work or anywhere there is a military related constituency. I would say definitely connect with your local VAs to find out who those folks are. And they will be a valuable resource to you to connect to your schools in order to connect to families and community at large. They do a lot of work, community work. There's all kinds of work that those local VAs are a part of.
Thank you, Adrina. Maybe our panelists want to do a few moments of closing thoughts. Go ahead. And then, of course, you could wrap it. Adrina, why don't you go ahead? Monica of Jackson. I got to see the Polar Bears in action a couple of months ago. Monica?
Thanks, Pete, and thank you so much for coming to Jackson. Great memory having you here. My last thoughts really for anybody that is seeking to be a point of contact, it's a noble cause. So if your school is not a Purple Star school, it's something that you're thinking of, you know, first and foremost, find somebody that has that military connection, and maybe they don't have time or can't be that POC for you, but they'll certainly school you up on, you know, what that means. And you want to get somebody that, you know, can reach across the district. Some of our Purple Star schools are a single school, but here for us, being 6 schools wide and 6,000 students, it's really important to have a single person contacting for, you know, events such as this, reaching out to Pete and Chip and being that point of communication to make sure that all of the good resources get out to the right people and in a timely fashion. And so if anybody here in the town hall wants to reach out to me personally about being a point of contact and how we've structured that at Jackson Local, I hope that you will, because I absolutely love talking about this topic. So thank you for having me today.
Thank you, Dr. Monica. That's awesome. Anyone else want to provide some closing comments?
Hey, Adrina, this is Chip Merkel.
Hi, Chip.
How are you?
Thank you. Wonderful. Hey. I'm glad you popped on.
Well, thank you. I just want to say kind of in closing how important it is that for you folks that are in the schools, how you make a connection with these kids, or at least know who they are, because you're the ones who are going to be able to recognize the red flags more than other folks. You see these kids every day in the building, and it's just really important that you're able to make that connection. And it's also nice to know who they are in case, you know, a family is going through a deployment. You know, it's like General Harris said, we have, you know, over 2,000 people right now working in the hospitals here in Ohio. Some of them are working close to home, some of them are not. So I just want to close with that. And we really appreciate everybody taking their time this afternoon to join us. I hope you got as much out of it as I did. And thank you, Adrina, for doing this, and the panel. We really appreciate it.
Any closing thoughts from Erin, Sarah?
No, just thank you to all the teachers and administrative staff that are here, taking the time out to learn ways to engage military connected youth. My heart goes out to you as a mother and all that you have to do in our school system facing COVID and mental health. And I just appreciate them taking the time out to learn how they can support our military connected youth. So thank you all.
Thank you to a wonderful group of experts and colleagues. We really appreciate you offering your time for the town hall today. Thank you so much. Thank you, Chip, and thank you, my wonderful colleague, Pete LaPiva.